The seed for higher education was really planted within me when I was really a young child, when I was in my teenage years in middle school. My family really struggled through a lot of adverse circumstances. My parents have always worked low-wage jobs, and as a result, they didn't have access to the health insurance that they needed to be able to see the doctor. And since that time, their health declined quite sharply, and they've lived with a number of chronic diseases. And so that's when I became committed that I wanted to go to college in order to become a physician, so that I could come back to my community and open a free clinic and be able to provide healthcare services for my community members, regardless of their ability to pay for services. I must say that really the exceptional mentors that I have encountered at CSUN have been phenomenal in my journey. In 2017, I joined the National Institutes of Health Biomedical Research Training Program on campus called Build Poder, and that was an amazing catalyst for my desire to really serve underserved communities through an evidence-based approach. And that then led me to go off to the Harvard School of Public Health, where I did a fellowship in public health and healthcare policy in 2018. And there I really was able to study with a phenomenal mind, Dr. Sarah Bleich, who was the former senior policy advisor to President Obama. And I really worked with her to understand really food injustice. And throughout my journey, I've really learned that this is an issue that didn't just affect my family, or my community even, that it actually is a systemic issue that many communities face across the entire nation. And this is, systemic poverty and injustice and racism that perpetuates a lot of the issues that underserved communities face in being able to access healthcare services. So in light of the recent killing of George Floyd in Minnesota, this has really ignited my desire to continue the work that I'm doing, because throughout my time at CSUN and in studying public health, I really learned the nuance and the intimate relationship that exists between socioeconomic factors such as race and ethnicity, as well as policing in communities of color and how that affects human health. I may not be able to change the world, but I can certainly impact the community that I'm within. And if I could inspire just one person other than myself to fight for change, then I've really helped to change the world in a positive way. And I hope that that person can then go on to ignite the spirits and the determination of somebody else, and that can really change our world in a very positive and meaningful way.